A renowned bariatric and general surgeon from Las Vegas talks about his education and experience. He specializes in advanced bariatric laparoscopic surgeries, complicated hernias, and gallbladders. This is a 6-part video series. In this video, he talks about the surgery for incisional hernia.
I'm a bariatric and general surgeon. I completed a fellowship at USC in advanced laparoscopic surgery. We addressed a lot of complicated general surgery issues such as complicated hernias and also complicated gallbladder disease. Although the majority of my practice is bariatrics, I still do these procedures. An inguinal hernia is another hernia, which is a hole with something coming out of it. So for example, if there was a hole in the wall and insulation was coming out of it, that's a hernia. An inguinal hernia happens in the groins. It's most common in men, and it's usually results in a bulge, a growing bulge down in the groin that can be quite painful. They are fixed commonly either open with a small incision or laparoscopic, and they're fixed using mesh. The mesh covers the hole, and the body scars in over the mesh and makes a nice solid repair. The umbilical hernias are the hernias you see if someone has a little bulge at their belly button. That's an umbilical hernia. It happens because there's a defect there naturally occurring, and for some people that defect opens up too wide and stuff starts to bulge out. The repair for the hernia is to put the stuff back inside, clean off the edges, and cover it with mesh. So that would be a mesh repair for an umbilical hernia. They're they're usually very straightforward to fix, and people get great satisfaction out of doing so. Ventral hernia is along the front of the belly. Commonly they arise when there's also been cuts along the front of the belly. So if someone's had a previous big operation with a cut down the middle, they'll have a ventral hernia. They can be just one hernia, or they can be multiple hernias. For example, I had a lady this morning who had a big cut up and down, and she had 2 or 3 different hernias poking out there. So ventral hernias. They are fixed by closing the holes. If the holes are very small, they can be sewn up and closed. If the holes are bigger than a centimeter or so, it's time to use mesh and put some mesh in there, which looks like a screen material, plastic screen material. Cover it up and let the body scar it in to form a nice solid repair. Hiatal hernias are interesting because a lot of people have them. They don't know about them. A lot of people have been told they have them. When they become important is when you're having problems. What sort of problems do hiatal hernias give you? They give you heartburn, bad heartburn, occasional pains in that area, and a ball right here at the bottom of the chest. And then when you're having those problems, it's worthwhile to fix the hiatal hernia. A hiatal hernia is a hole in the diaphragm that's too big. And that hole is too big around the esophagus. And what happens is stuff from the abdomen, belly, goes up into the chest. So you have stomach actually stuck up into the chest. And that stomach needs to be brought down, released, cleaned off, and brought down into the belly. And the hole needs to be closed up. If it's a small hole, we can close it up with a couple of sutures, and that usually prevents it from reoccurring. If it's a very, very large one, occasionally we use plastic or mesh to help scar in a nice solid repair and keep the division between the belly and the chest.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote